everybody. I'd like to welcome you all here today. My name is Maria Navarro. I'm from Del Sol. Thank you. I've been a nurse for 30 years and 25 of those have been at Del Sol Medical Center. With me is my co-host here, Jeff.
Hello everybody, my name is Jeff Taylor. I am an ICU in the RN in the ICU at Las Palmas. Been there for 6 years. Got a little statement prepared for you here. Today we stand before you united in our fight to improve the level of patient care in our beloved city of El Paso. Our fight is for the benefit of our patients, both the ones we have now and the ones we will have in the future. For too long, the corporate model of healthcare has placed excessive profits over the well-being of the public. Our hospitals have been recognized nationally as outstanding facilities for the delivery of healthcare, which is a testament to the nurses' commitment to you. We have labored under circumstances that have stretched us to the breaking point in our ability to continue to provide the best care we can while the company rakes in enormous profits. The fact is, Las Palmas and Del Sol lose nurses at a rate that is more than double the national average. That's right, double. This serious trend places patients at a disadvantage as there is a constant stream of new nurses who lack the familiarity that comes only from experience at the bedside. One of the reasons experienced nurses are leaving is because of understaffing and the result of that dynamic on working conditions. In our negotiations with the hospital so far, I am pleased to report we have made substantial progress to improve chronic understaffing. But the other reason for loss of quality nurses is in such alarming numbers is that the pay is less and there's a cap on wages. That might drive down costs and drive up profits, but it drives nurses away from our hospitals. A workforce that is made up of experienced nurses improves the standard of care as well as provides mentoring to newly graduated RNs, a way to help patients and retain nurses. In the last 3 months of 2011, HCA, our parent company, had profits of almost $2 billion in 3 months. The last 3 months of 2011, they had a net revenue of $1.9 billion. Last year, Forbes magazine reported that Del Sol was the #2 hospital for profits in the entire country. 45 cents of every dollar they took in was profit. Let's be clear, those profits are coming off the backs of nurses who work tirelessly to keep you alive and healthy. And let's also be clear on something else. That money leaves El Paso and goes into corporate bank accounts, providing less benefit to local businesses struggling to stay alive. It is absolutely wrong that that money is leaving our community. This is a fight to keep experienced nurses in our hospitals and to recruit the best nurses we can to improve the level of care we give our patients. The way to do this is to bring wages at our facilities up to the city standard, wages that will remain in our community and benefit our community. Respect for nurses equals respect for patients. You deserve it, we demand it.
As one of the representatives from Del Sol's negotiating team, we are demanding that HCA come to the bargaining table and in good faith work with us toward establishing a good situation where nurses can want to stay in El Paso, work for El Paso, because we are El Paso. We will make El Paso better health-wise, just community-wise, if we all stick together. And by doing so, this is a demonstration that we have seen here today. Thank you all for coming in,
Houston,
supporting
Corpus
us.
Christi, all across the state, we are fighting the same battle against the folks who are looking for the same thing, and that is the bottom line. That's all they care. And it is easy for them to forget that there are families, workers, behind the numbers and the spreadsheets they're looking at, whether it be here at the administrative offices or up in Wall Street. There are real people behind those numbers, and if those people are not taken care of, then everyone else suffers, and in the long term, even they cannot make good profits. So when you eat your seed corn, when you're only looking at the short-term profit, you are hurting your future prosperity.
We'd also like to thank and recognize Occupy El Paso. They're here out supporting us too, so thank you very much. We really appreciate it. Brown Berets, thank you.
There's never been a nurses union in Texas that had collective bargaining rights in a private sector hospital. Never. Until these nurses did it. So everything these nurses do, it's a historic first in Texas. You sneeze, it's a historic first. You have a rally, it's whatever you do.
Las estrellas y la luna, yo no bajaré la luna, y las estrellas tampoco, y aunque no tenga fortuna, me querrás poquito a poco. ¿Qué voy a hacer? De veras te quiero, yo te adoré, olvidarte no puedo. Yo sé que hay muchas mujeres y que sobra quien me quiera, pero ninguna me importa, pues te quiero a ti, morena. Mi corazón te ha escogido y llorar no quiero verlo, que el pobre ha sufrido mucho y ahora tienes que quererlo. ¿Qué voy a hacer si de veras te quiero? Yo te adoré y olvidarte no puedo.
Yeah, see, that's the thing, but all of them still, I think, shortchange.
Si de veras te quiero, yo te adoré y olvidarte